If the coronavirus has you concerned, nervous, slightly fearful, or questioning what's the real information, truth, sorting out all the facts from misinformation, today I'm going to share with you updates about the coronavirus, what we know now, as well as a hot off the presses freebie download that lists out some really powerful antivirals, as well as tips and resources that you can use at home to protect yourself, your family, and all your loved ones. So without further ado, let's kick off today's coronavirus video update. Welcome back, friends, and to all of you new joining, welcome. I hope you will join our community here at Natural Health Resources. I'm Dr. Melissa Gallagher. I'm a naturopathic physician, and I focus on natural treatment to an assortment of health issues, crises, and diseases. Naturopaths are functional medicine providers who assess the root cause of illness and disease. My goal today as a naturopath is to equip you with some tools, resources, tips, as well as takeaways that will equip you, your friends and family, and anybody you know who is slightly concerned, as we all should be, about the coronavirus. I'm going to equip you with a whole bunch of resources, things to consider, update of information that is important to know currently, and also at the end of the video, if you stick around, I'm going to share with you how to grab this free download. So today's video is an update to my first coronavirus video back in January. And that video was very popular. It spawned a lot of questions, a lot of information and inquiry that we were sharing and communicating. And since that time frame, a lot has happened. Here's the reality of the situation. This is a problematic virus. It is now in its community stage, which means we are potentially all at risk of exposure. Now, one of the things that you're probably hearing on the news are the mortality rate percentage, which it's at 3.4% right now. That probably seems like not a big number, but it is, considering that usually our numbers for an epidemic would usually be 1% or below. So it definitely has us in this categorical state clinically of assessing, okay, this is a very serious illness, particularly for those who are compromised. So I'm going to leave that, let's table that, but I want to give you some information. It's predicted that 40 to 70% of us, so yes, I said 4 to 7 out of 10 individuals could potentially, watching this video, come down with the coronavirus. Now, I know that probably is very scary and you're like, what the heck? Oh my gosh, I don't like to be fear-mongering by any means, but I want to be very clear and honest with you. We need to set our expectations about our exposure. And the reality is, friends, we all have the potential risk of exposure. There's different levels in terms of how will that exposure then manifest in terms of the significance of this virus on our own bodies. And that's a distinction I want to dig into further in today's video. But first, I want to give you some information about what we know today. As I mentioned before, this illness has a 3.4% mortality rate. Now, this is taken in the context of current state, particularly concentrated in China. So the population is different, the risk factors are different, containment was a little bit different over there, but we need to be educated, armed, and dangerous with resources so that we can avoid the extent of our exposure. This particular virus is showing an incubation period of between 5 and 7 days and 14 days. So it could be 5 days after exposure, you start to feel some symptoms. Maybe at 7 days, maybe at 10, up to 14 days. That's a long period of time, 2 weeks potentially, that you have had exposure and might be emitting exposure to others. This information, friends, is rapidly evolving, and that is why we list this in the clinical terms as being in the community spreading phase. So because we're in that phase, now it's time for us to be armed and dangerous with resources and tools to minimize that community spread. With that long of an incubation time period, the risk is that there could be a lot of people exposed that might not even be showcasing symptoms. They could be asymptomatic, but their own immune system is dealing with the virus. And for those that it progresses into a full-blown case, now we've got potentially 5 to 7 up to 14 days of all sorts of community interactions and exposure. This is the one statistic that I think is very important to note. Of all the cases that have been documented, 16%, only 16% are considered in the severity phase. So these are patients, or what I consider a health profile, that are at risk. Elderly, the infants and young children, anybody who is immunocompromised. This also covers autoimmunity because of the whole immune connection there, as well as individuals who have any type of respiratory disease, COPD, emphysema, low lung capacity. Maybe you've had a history of lung cancer, lung surgeries, lung disease. Also, any individuals who are undergoing any type of chemo, radiation, anything that would put you at risk, meaning your immune system is already decreased. Now, other categories of folks who are in the risk category are folks with heart conditions, heart disease, congestive heart failure, even I'd categorize arrhythmias or AFib. Also, individuals who have, again, that reduced lung capacity. So let's say you are the type of individual who always comes down with some sort of upper respiratory infection. Maybe that then progresses into a classic walking pneumonia or pneumonia state. You, if you're in that category, are at a greater risk because this particular virus affects the respiratory system. And really the true testing methodologies that we're seeing that gives us definitively the answer of whether somebody has coronavirus or not. And this is COVID-19. So this is this particular type of coronavirus because coronaviruses have been out there for years. That's why you see on your Lysol bottles and some of the other over-the-counter cleaning products, they say they fight coronavirus, not this particular strain. So let me make some clarifications here. CT scans are showing lung tissue, cellular tissue changes within the lungs. This could be the bronchial passages as well as one or both lungs. That's problematic for anybody who has any type of lung weaknesses. And if you experience any of these upper respiratory imbalances or weaknesses, you are already aware of it. So know that your risk factor is higher. And if you were to be exposed to it, there's a potential risk that that severity percentage, 16% who have the severe category, they are individuals with these backgrounds. And so I want to make that really clear because I know everybody's freaking out. I'm actually attending a conference in Vegas next week. So the coordination of it and emails have been coming out from the coordinators and the PR reps and everybody who's logistically involved. There is a lot of fear. So the conference is not being canceled. It's in the medical world. So we are very tuned in to the reality. We know the numbers, we're staying on top of things, but it does require that everybody attending, everybody flying out and everybody being there, our venue providers, the housekeeping, everybody is tuned in to keeping our risk lower by cleaning processes, by ensuring that we have access to whatever we need. Sanitary, like hand cleaning, that we've got access to masks if we need them. And by the way, so that conference, as well as the fact that in 2 weeks to today, we are having our wedding down in Sarasota. Well, we have a lot of friends and we have some compromised individuals who are flying in for our wedding. So partially I am creating this video for those individuals, which by the way, I love you all and we're really excited to see you in 2 weeks. But I'm also creating it for all of us, okay? For all of you who are sitting on different continents all over the world, all of you who are watching the news and literally breaking into a sweat, feeling your anxiety and cortisol levels rise because you're fearful, rightfully so, of very dangerous disease. But I want to equip you with information that hopefully will calm your nerves, but also get you resources that you can download that will begin to boost your immunity, start to give you some things to consider in terms of your home cleaning, home air processing, also things to do when you're out and about, if you do have to travel, just consciousness in terms of lowering your exposure is key. So that is something that we'll talk a little bit about. This tends to be something where we're seeing in the severe cases, people are in quarantine. So my first video back in January, there were no cases of the coronavirus in the US. Well, now we have cases. We have cases in multiple states. We have had 11 deaths from coronavirus here in the US alone. It has made its way into Africa. It is in Europe. We've seen cases in Italy. It's in Japan. We're seeing the spread of this across the globe. So some of the things to know if you are in this risk category. One of the things, at least here in the US, friends, there are 75,000 test kits that the CDC has right now. So these test kits have been dispersed to local and state health labs. Some of these are university-based collaborative labs, but for the most part, your doctors in your local area will know and have access to who and where to go in the event that you find yourself coming down with the symptoms of the coronavirus. So I want to share with you some of the beginning stage symptoms. Because of the focus on the respiratory system and its attack of the respiratory system, it's not uncommon for folks to have a little bit of a headache, a mild fever, and a cough. So these symptoms are very flu-like. And so this is where it gets a little tricky. We have cold and flu season that is at its height. Then we also have potential coronavirus symptoms mingling and meddling into that. So in the event that you progress to where you're having breathing difficulty, this is where going to a facility like your university hospital will allow the practitioners to be able to screen you, not just test you, but screen your lungs. So the CT scans of the lungs are the definitive measurement of the progression and severity of this disease. So here in the US today, and this is, again, very mobile. It'll probably change in the next hour, 4 or 5 hours, because this is the way these epidemics work. They grow and there's evolution and there's spread, community spread. But currently, the US has 150 cases, known cases, tested, diagnosed cases of coronavirus. The concentration of those is up in Washington State, particularly King County in the Seattle area. Now, what we're seeing as a national response, we're seeing internationally as well. What's happening is there is a quarantine process that occurs if an individual gets diagnosed. Then there's also this process where who did you come into contact with, and those individuals get quarantined as well. So this is that community spread phase where researchers, clinicians are starting to circumvent the community spread by starting to see the webbing of our social contact. So one of the things that we're seeing in King County, for example, is severe cases are being ventilated. That whole incubation process being 14 days, there are individuals who 2 weeks ago were diagnosed, they're on ventilation, and they will get through this on the positive side. But it requires fast, immediate attention for the medical providers to get an individual into a quarantined status or a quarantine facility. So medical providers in these severe cases, they are quarantining individuals in the medical setting. So King County, for example, in Washington, there's been a facility that the county, state, whatever the public bodies that be, they have identified a location where they can bring potentially at risk or exposed individuals and have them in a quarantine setting. This is a unique kind of process to dealing with this, and we have seen this happen in China. And so we're going to start to see the modeling of what was successful in containment in China happen in other parts of the world. So we're going to see that here in the US. It will freak everybody out. The idea of quarantining people, you're staying at home. Doctors' offices are now being urged to do more telemedicine communication so that we minimize our community spread of sick people coming into a facility. We've had our first known case here in the US of a healthcare provider being exposed. And that definitely is something we need to consider. Like, are you prepared in the event that you need to work from home? Does your company have the ability for you to maintain quarantine in your house and you can work from home? School systems, they're starting to put in place different parameters and guidelines in terms of how to deal with an epidemic that would hit the school. I'll tell you, my son's school was hit by the flu a month ago, and they closed the school down for 2 days. He's in a private school, so they have a lot more kind of quick movement, and they have a safety committee, and the nurse is part of it, and the administration, our safety counselor, whatever. They determined that we were going to sanitize the school, and we were off for 2 days. So these things will take place. We will start to see this occur more frequently. We'll also probably see a greater clamp down on the travel restrictions. So for instance, I am traveling to Vegas next Thursday. I think it's Thursday. And they've already, the people who are putting on this conference, they've already communicated that the State Department, there are no flights coming in from China, South Korea, or Italy. And so those are the three majorly quarantined, if you will, restricted flights right now. That could change. I think Japan might be included in that as well. I pulled some of this information yesterday. Again, this stuff is evolving and changing really quickly. That being said, if you do travel, one of the things that we are implementing, Brian has a trip early next week. I have a trip later in the week. The following week, we all three, with little Gabriel, get on the plane and we go down to Sarasota for our wedding. We are going to be wearing masks. So many of you know I talk a lot about airplane germs. They're horrible. So because of the spread that we're seeing, airplane travel or any type of travel via ships or boats or whatnot, there's definitely that movement, that transport moves the virus. So if you have to travel like Brian and I both do next week, and then we're traveling the week after, or there's any future travel, it's important for you to assess your risk factors. We're all three healthy individuals. Out of the three of us, the greatest risk factor is Gabriel. His immunity is still building, and because of all of the things I know about airline travel and exposure in airports like Atlanta's airport, which is, oh my gosh, it's like, I cringe at all the germs there. But the reality is that we are going to be wearing masks. I actually have ordered them. I'm going to throw the masks that I have ordered for us. There's a kid version. There are adult versions. These are the safety protective masks that if you are going to buy masks, this is what you want to invest in. This morning was over at Walgreens. I had to grab something. And so I took a little cruise down the aisle where they've got, you know, the masks and gloves. Gloves and masks are completely gone from like the Walgreens. I heard from somebody earlier this week that Trader Joe's was limiting the quantity of hand sanitizers. The Walgreens I visited, they were also out of hand sanitizers. So people are starting to get really concerned. I don't think it's a bad idea if you do plan on traveling or have any greater than normal exposure risk to get yourself a mask in that transportation time or that period of time. So if you're going to be in a public setting, it's not a bad idea to have a mask with you. They do make a lot of these disposable, so you can buy a pack of 20 or 30. So one of the things, friends, I really want to make clear that I'm not trying to be doom and gloom. I'm trying to educate you and equip you with information because of the rapidly evolving, constantly changing evolution now every 12 hours, every day. And now that we have cases here in the US and this is community spread phase, it is important to note that we currently are in a public health emergency. That has been declared on the 31st of January. So we've lived through February in this public health emergency. We do know that the CDC is working. There were some delays there, but I think they've got all the things in place now to make sure we're beginning to equip all the facilities with tests and have access. We just saw Congress pass spending access. So this week, we've also seen California declare a state of emergency with their coronavirus cases. So it is very important that we take this seriously. Again, there's no reason to have any fear, but the risk factors, if you fall in that category, Brian's parents for sure fall in this category. I was just talking with them earlier today. They've canceled their European trip for May, and they had plans to go to, I think, 4 or 5 countries bordering Italy. And so they were like, you know what? We're going to postpone it for a year. That is smart. Brian was like, oh my gosh, they're overreacting. But I think that is a smart decision because both individuals have certain health challenges that put them at risk. And I think it's very important that you be aware. We cannot be ignorant. We can't be ostriches and bury our heads in the sand and la la la, this doesn't exist. Despite what we're hearing on some media sources, this is not any political conspiracy. This is a legit dangerous virus that is moving across the world. This is not uncommon. We see the cold and flu season move across the world, but the status of the mortality rate has officials alarmed at 3.4%. That's a high rate, 3 times the normal level. That is any reason, that's just cause to cause alarm. The other thing that we're seeing is that in the community spread phase, we're going to see higher cases. That's where we get that 40 to 70% of us will come down with this virus. It's how does our body handle this virus? If we're immune suppressed, if we're immune compromised, if we have a weaker heart, if our cardiovascular system, our lung health, even our immune health is compromised, then it becomes important for you to go through additional risk factors and measures to boost your body's immunity, which is why I have a free guide. Okay, so I've got a list of some really good things for you to get into your body. There are nutrients, there are botanicals, there are compounds, there are mushrooms in here. Also things, friends, we need to consider: masks. Which ones are going to be qualified that will fight this? I noticed at the Walgreens, people just got everyday masks. Those things will give them no protection. There's a certain quality of professional grade masks. So I've got a list and information where you can go to grab those. They're not as expensive as you think. There are definitely companies that are trying to take advantage of this, but there are definitely ways to get some of these things in your hands and to be ready, because being armed and dangerous is going to protect you. And so that's what this antiviral checklist, the anti-corona list, is all about. The other thing that I talk about is the cleaning process at home. So there's certain kind of process, procedure, protocol that is being implemented. It's not a bad idea to implement the same things you're going to see in a hospital level or even in your school system. We want to minimize our risk factor at home. The other thing that I address on this checklist, and if you download it, again, it's free. I'll include a link down below where you can grab my antiviral checklist. This checklist is great for anybody who needs immune boosting, but this particularly is all about really ratcheting up the way that we can protect ourselves right now. So at the current state, this is going to be my best resource for all of you to grab and download. We also want to think about our water sources. We want to think about, we're going to gyms and we're going shopping and like all these things that you want to be really cognizant of, and minimizing our risk of exposure in our noses, in our mouths, the oral cavity, and our ears. And I actually have a segment in the checklist where I talk about oral microbiota. That's the bacteria levels of our mouth. There are things that you can do to protect your mouth from a viral invasion. So if the coronavirus, you do come in contact with it because of the community spread, and I know we have a lot of viewers, shout out for all of you down in the comment box. Are you in Washington? Are you in California? I know we have a lot of viewers out there. And so I want to make sure I'm arming you and equipping you with resources. So do consider downloading this checklist. Let me know if you have any questions down below. I've had a lot of questions. It might be something we might look at doing actually doing a live session. I actually have this really cool new soundboard thing that I've got to play around with because you guys know I'm not technical, but I wanted to check in. I know this is kind of an unconventional time frame on the video release. So my intention here is to really equip you with things that will put your mind at ease and build your toolbox. I mean, I'm not joking when we have all of these things. If not here, they're on order, they're en route, they're arriving today. We have to be diligent, friends. So this is not fear-mongering, friends. And I know I got a little grief about the coronavirus update because it still was really new early on, and people, it's very different when you hear, oh my gosh, the first case has made its way to the US. And I think at that point we had one case in Canada. But this is a concern. I'm concerned, and I'm concerned for our viewers. We're at 270,000 viewers. That's a lot of you. And if I can touch you in this format and help you get your body stronger, boost your immune system, and equip you with things to do every day, cleaning information, hand washing, all of that stuff. There's a potential that we collectively can minimize this community spread. So friends, thanks for tuning in. Please grab the antiviral checklist, and any questions you have, just let me know. I'm here for you. And don't freak out. Stress is not good for your immune system. So just take a deep breath if you need to do some deep breathing exercises. So it's not a bad idea, friends, to start carving out some DIY stress relieving exercises and activities at the end of your day, just to de-stress, because we're only going to hear more and more. And community spread phase means there will be 4, 5, 10, 20 times the amount of cases. We're going to see it. We're definitely going to see it on the upswing. The US, just like other countries, there's going to be a time frame where the gears get in place within the healthcare professional world, and we figure out what's the best way of containing this. So China experienced it. We're using them as a model. They were successful in some containment. I think that's really important to know, that their success will be our success as the healthcare providers and professionals in the field implement that. So we can do our part as community members, because this community spread, it really is all of us being diligent, working together. If you feel ill, you're having symptoms, first of all, don't go to work, don't go to school, don't go to any major areas, community-based areas, stay home from the concerts, stay home from traveling. And if you progress in a few days, you're getting the headache, the cough, now it's your responsibility to get tested, okay? And there's a lot of good resources. I'll include a ton of resources down below where you can gain access to CDC website. I'm checking that every 6 hours, reading that. There's some good resource guides that are staying up to date. Very recently, I think as a middle schooler, a teenager, developed a really great resource site. I'll include that too. I'm so impressed. It's going to take a communal effort, friends, to minimize the extent of this epidemic. And it's an epidemic. It's not necessarily a pandemic yet, but it's an epidemic, and it's a world health emergency. And this becomes necessary for us to come together, grab your checklist, okay, grab those, and stay informed, and I'll keep updating you as I get more information. Thanks, friends, for tuning in. Lots of love, and I will see you in our next video.